We can start.
Thank you, Renia. I'm just going to share my screen. So give me a second to do that. Good on your side?
We can see the slides.
So good evening, everybody, and welcome to the SAMF webinar. My name is Marc Blockman, and on behalf of South African Medical Association and the Division of Clinical Pharmacology, I welcome you here all to the webinar and the offering and the celebration of our digital formulary offerings for the South African Medicines Formulary. The idea of this evening is to talk a little bit about SAMF and its digital offerings, and to provide a demonstration on its functioning and how easy it is to navigate and to find medicines information at your fingertips. We have a panel as well, which will be there to answer questions, and I'll be co-hosting with Dr. Rephaim Mpofu, who will be providing the demonstration at the end of my introduction. So just to remind all, SAMF has gone digital. We are in the App Store as well as in Google Play Store. And this is an extension of the formulary, the book version of the formulary, which we are now being able to offer in various digital platforms for ease of use. And if you remember, critically, the SAMF is an up-to-date medicine information provision, as well as it provides unbiased information, which is at your fingertips. Just to give you a little bit of background, is that the South African Medicines Formulary was first published in 1988. We are now in our 14th edition. We should celebrate that over many, many years. It has a strong collaboration between the South African Medical Association and the University of Cape Town, the Division of Clinical Pharmacology, in the formation and the provision and publication of the formulary. And in line with the global trends of digitalization, we've now been able to collaborate and to provide the South African Medicines Formulary in various digital formats as well. So there's an app and an online version as well. Just to introduce the panel, I've spoken about myself. I'm from the University of Cape Town, Division of Clinical Pharmacology and Groote Schuur Hospital. Nushka Swart, she's the manager of the Medicine Information Center. Diane Smith is from the South African Medical Association, who we strongly collaborate with. Dr. Mercedes Abrahams is from Avira Health, who in fact is the colleagues that have in fact taken the book format and made it into the digital offering that we're able to celebrate this evening. And thank you very much, Mercedes, for that. And then Dr. Rephaim Mpofu from the Division of Clinical Pharmacology will be providing the demonstration. So there's a new SAMF experience from the book, where we were looking up frantically the index and finding the page, to now having an app version on all the platforms, all the phones, as well as laptops, tablets, and obviously on the desktop. So we've moved on to a complete online version of the South African Medicines Formulary, and to provide information wherever you are at your fingertips. It's available as an online web portal, as I've suggested, smartphone app, Android, Apple, iPhones, the tablet, iPads, laptops, and all the computers. And importantly, is that your subscription will allow you to have ability to log on with 3 devices with your individual subscription. The good thing about the formulary, it's not developed by a small collaboration in the Division of Clinical Pharmacology. The beauty of the SAMF is that it has a group of well-respected clinicians from far and wide and within all the fields of clinical medicine who provide the content and the editorial aspects to the South African Medicines Formulary and guide what's important and what's not important for clinicians, all healthcare professionals at their fingertips. What's nice about the South African Medicines Formulary, there are no advertisements, there's no adverts, no annoying ads as you log on and as you move between medicines and while you're looking up some critical information. And what we thought would be essential is that the app would always be offline, and that you didn't have to have internet. You may need internet to update, but you would not require any internet access to be able to utilize the SAMF when required, no matter where you were, and especially if you, for example, had load shedding. The importance about the SAMF is that it's updated on a regular basis. It says that we'll be updating every 6 months, but what's important is that as we speak, there's an update occurring. People are looking at the literature, colleagues are reviewing, and there's a regular update, which means that not only will we provide a 6 months, but it is really important information that can be uploaded very quickly and be at your fingertips. Critically, and I've said before, and I will continue to say, that it's an unbiased representation of the data. It's an evidence base. We are not influenced by the pharmaceutical industry or any industry. The decisions are made in collaboration with SAMF in-house in terms of what the content looks like and how we represent the content and what medicines we choose to represent within the formulary. And there's no coercion or undue influence from the industry. And importantly, and which I think is a critical aspect, is that via the app, you can now contact the University of Cape Town's Medicine Information Center. And that means that there's a holistic offering of medicine information at your fingertips. So if you can't find it on the app, which would be unusual, but if you can't and you have a question which extends into the clinical, for example, or something which is more complex, one can very quickly get hold of the Medicine Information Center and get an answer. And again, that answer comes from a highly respected information pharmacist, as well as the clinicians within the division and outside of the division as well, to provide those answers. We are, obviously, it's got a powerful search function. You're able to search in trade names as well as generic names. You can look up the diseases or certain medical conditions. So it's very easy and to be able to find the information that you want. And you don't have to think of the medicine, for example. You can think of the clinical condition and then be reminded of the medicine that you may want to prescribe as well. Importantly, and essentially, there are special population prescribing, for example, in children, liver and renal disease, and medicines that cause QT prolongation and the risk of torsade at your fingertip. There's also an ability to have your favorites and to have information that you utilize on a regular basis through a favorites tab. So you can go to that on a regular basis without having to go through the normal functioning to get to that medicine information which you require. It's convenient. You can move between devices and obviously find information very quickly, and Rephaim will show you that in the next few minutes. And it's rapid access, and because it's free of having to be on the internet, it's downloaded on your device, which makes it even quicker. There's 6 monthly updates, and if it's critical information, that will happen obviously much more frequently if it's critical for the country and for patient care. And obviously there's no space requirements or constraints. And so what we'll be doing is we'll be able to expand the monographs, the offerings, the number of medicines into the app as well, which means that the functionality increases exponentially. And there's an ability to search with keywords. Having said all of that, I will hand over to Rephaim to provide the demonstration. I will stop sharing now, Rephaim.
Great. Thank you for that. I'm just going to see if I can share my screen. And a welcome to all the attendees today. Let me just put up my screen here. Okay, hope everyone can see my slides. Prof. Marc, can you see the slides?
Perfect, thank you.
Fantastic, great. Okay, so we're going to go through a little bit of a practical session of just basically how one can maximize the utility of the new SAMF app. I've been a user of the SAMF app for many years now, but really over the past year or so, I've found my use of it increasing exponentially because it's just available at your fingertips. Having a cumbersome book was sometimes a little bit of a hindrance. And so having it available on an app has just been able to magnify the amount of usage I've been able to get out of it. Okay, so I can just get to the slide pictures. All right, so we're going to do a little bit of a walkthrough. I'm going to start off by giving you some screenshots of the app in the phone. It was just a little bit more practical to do it this way, but it's a very intuitive walkthrough. The app is actually very user-friendly, very easy to use. Then once we're done with that, we're going to go onto the web portal where I'll be showing you with a few case demonstrations. So some of these points have been mentioned already, that it's really easy to browse through the formulary for those that are familiar with the SAMF. It's really easy and it's really broken down in a very kind of intuitive manner. And you're able to search either by generic name or by trade name or by disease. And so that's quite useful as well. And interestingly, you're also able to combine multiple terms. So for example, if you want to search hypertension together with an agent like a diuretic agent or something, then you're able to combine those multiple terms and you get various hits that you can then pick based on the results that you're looking for. So this is just going through the main sections of the formulary. As you can see there, it's broken down by organ class system. You've got alimentary tract at the top, a cardiovascular system, which is selected there in this example. You've got some other categories such as musculoskeletal system and central nervous system. And then let's say if you do want to click in the cardiovascular system, then your next page would be the one in the middle there, where your the different subcategories of drug classes would pop up. There, as you can see in the picture, the diuretics class would be selected, and from there, that's further subdivided into also very useful categories such as low ceiling diuretics, as well as high ceiling diuretics and potassium sparing agents. Obviously, this helps us sometimes when we forget a little bit of our pharmacology, just reminds us and guides us as well. So you can see very user-friendly, intuitive format there. Or so let's say we've clicked in the low ceiling diuretics. We then go in there and that gives us hydrochlorothiazide, which we're going to open up. And there's your monograph that opens up on screen on picture number 4. And the monograph is also then subdivided into the headings that you should be used to in the SAMF book. The SAMF app has a section at the top where you've got your scheduling, which is quite useful actually. You've got the level of drug that level of care the drug should be available at for those that are practicing in the public sector. So for example, hydrochlorothiazide be available at the primary level for the EML, and the various routes of administration, as well as certain special populations, which are quite interesting and quite useful that you can click on actually. You've then got clinical notes below that, where you've got the introduction as well as clinical notes. So you can actually click these. These are hyperlinks. These are active links. And then if you click that, for example, you'll then go into the next page, which is screenshot 5. And that will give you a little bit of a background information on thiazide diuretics, which are also really useful. There's some great pearls of wisdom there that you can use. And one of the advantages is it's also quick reading. It's not very dense text as well. And so I find that quite useful as a reference text rather than as a dense textbook. So let's say we are looking to search for a drug. for example, then you can click the search button, which should be available mostly in the bottom right corner. It's got a little magnifying glass icon, a green icon, and then that takes you to this first screen over there. You then enter your drug name. You can either enter the generic name or the trade name, as we mentioned, and that will give you your hits, the search results after that. And also includes, it actually conducts quite a wide search, so it also gives you pages wherein the relevant pages where that drug is relevant. For example, in screenshot 2, it also gives you the page where you've got drugs that prolong the QT interval. And so you can also then go into some of the clinical notes sections from there. If we move on to screenshot 4, that is just selecting the drug that you're looking for, and then into screenshot 5, that again gives you the monograph. And you can see there you've got the different sections from indications, a little bit on pharmacokinetics, contraindications, drug interactions, which are very useful, and then other sections such as adverse effects, special prescriber points, and adult dosing, which really, most of the times when you're referring to the SAMF, you're kind of quickly looking for the dosing, right? For adults as well as pediatric dosing. And so those, it's nicely laid out in that manner. There's an interesting feature, as was touched on before, the favorite section. You can actually add some of your frequent flyers, the drugs that you refer to frequently. There's a section towards the bottom of the mobile app whereby you can add certain drugs or certain pages to the favorite section. So once you enter a monograph, for example, in screenshot 2, then you just click the heart icon and that adds it to the favorite section. And when you then use the bottom icons at the bottom of your screen, you're able to then go to that favorite section, and warfarin, for example, will pop up. And you can refer to your favorite or frequently used drugs quite easily from there, which is a very useful feature. The other really cool and less commonly used section of the SAMF, at least in my opinion, is the prescribing section, which has a number of key important topics on, for example, special populations, whereby there's certain important principles that you may need to apply. For example, in special populations like patients with liver disease, patients that are mothers who are lactating, or in children, where it's got great sections that are of information there on prescribing. And so you can also just easily access that at the bottom, those 3 main icons. It will bring all of that up for you. In this example here, we're going to go to the QT interval section, and so you just click it, and that will bring up the subsections that you can click on any of the pages that you're keen on interacting with or opening. So let's say we click the prescribing QT section, that'll open up the table. This is in portrait view, but one of the great features is that you should be able to flip it depending on your phone settings to go into landscape, and that allows you to get a very good view of the tables. And so very easily accessible information at your fingertips, and it's obviously verified and credible info. So being able to turn the screen also allows you to get a great view of the tables as well. We can search by trade name, very similar principles. You press the search icon towards the bottom right of the screen with the magnifying glass. You enter in the trade name that you're looking for, and that should give you the drug that you want. For in this example, we're trying to figure out what TVK contains. We enter it in, we press search. And just a little nifty tip as well is that you can actually search by voice, which is actually really cool for those of us that do engage with such technologies. And you can see there TVK will return dolutegravir as the result over there, and that opens up the dolutegravir monograph. So lots of different ways that you can actually access your information. And then this was touched upon earlier about being able to actually contact other resources. But if you are looking to contact the MIC via the mobile app, whether it's Android or Apple, then you click the menu icon at the top of the section there, also known as the hamburger button. That opens up a menu, a drop-down menu, and you can click Contact Us, and it brings you all of the important contact information. If you actually click on these buttons with the or with the contact numbers, it actually just populates it directly into your phone app, and you can phone directly. Or if you do have a default email application on your phone, then that can also open that up directly into your email. And so that's really a nifty feature there that has been implemented in this mobile app. All right, great. We're going to move on to the web portal, and I'm going to do a little bit of a live demonstration here. So we'll get to interact with the application a little bit more. Just one or two important details is that once you're registered on the mobile app, and you've got your login and password details, you use the same info to log into the website portal. You can see the link is over there. Go to samfapp.com, and once you go in at the beginning, it will give you a very basic tut or rundown on the layout of the website application. And so the tutorial includes basic information such as how to find information and where you can find it, but really it's very intuitive. Again, you've got your top 3 sections there just below the SAMF logo. You've got the all, you've got the favorites, and you've got the prescribing. And remember that this is cross-portable from your mobile phone onto your web portal. So the same favorites list that you have for your mobile phone should be available for your website or for the web portal as well. And you can see there that's categorized into those categories, which is very useful. You've got the searching function, which is very similar to the app. You click the app, you click the search icon, and that brings you. I'm just going to see if I can actually get a pointer. That might just help. So you get, you are able to then search by typing in the drug that you're looking for into the search bar, and that gives you the various hits, A, of the drug, the generic, but also B, of any other important and relevant pages that contain that drug that you have searched or that you have entered into the search bar. And it's actually a very quick functionality as well. There's also the capability to search within pages or within monographs, and this is using the shortcut Control F. I'm sure you've used it in other apps as well. You've used it perhaps in your word processor documents, and just by pressing Control plus F, you're able to look for certain keywords within the monograph, and so that's quite helpful as well. Okay, so we're going to talk. We're going to do 2 or 3 cases, and then we're going to try and actually go to the SAMF app and see if we can be able to get info that can help us to manage. So the first case is titled A Swollen Knee. Got a gentleman named Peter, comes into your office. He's a 51-year-old male who presented to your clinic 2 days ago complaining of left knee pain. So it's characterized as 8 out of 10 with erythema and swelling for 3 days. He states that the pain was in and all around the joint area. He denied being able to ambulate without the wife's assistance, and unfortunately had to stay home. And he thought he had overdid it playing with the kids. The pain persisted throughout the day despite taking non-steroidal anti-inflammatories, and the pain mostly subsided by the following morning. Peter states that he had had a similar episode of sudden onset pain previously with his right great toe, but thought he had stubbed it. And just for other important history, he's also hypertensive, currently on hexazide, and you suspect, based on your history taking as well as examination, that the patient may have gout, and so you request a serum uric acid level or concentration, which comes back elevated at 0.8 millimoles per liter. So let's go to the SAMF. Let's go to the SAMF portal. So you've got your suspicion of gout, and you're just trying to quickly touch up and remember how exactly to go about managing it. So just to show you that this would be your welcome screen when you're trying to log in. You enter in your similar information there, and that brings you to this home page over here. From there, we type in, for example, let's say we just want to get a quick background on gout. So we type in gout, and the management of gout pops up, and we open that. That gives you a nice clinical prescribing or a nice clinical notes section on the treatment of acute gout. There are hyperlinks. For example, there's a colchicine hyperlink, there's an allopurinol hyperlink, and so you're actually able to enter the uricose, the drug of interest from there. So we're going to, for example, open up allopurinol. And so that will open up in a second. And there, from there, you can see the allopurinol web page or monograph opening up quite nicely there. You've got the favorites button, as we talked about earlier. And from there, you can see all of the details. You've got your pharmacokinetics section, just a little bit of interesting details and data about the pharmacokinetics, contraindications of which...
Sorry, Doc, if I can come in, your screen is still showing the case 1. It hasn't moved over.
Right. Okay. All right. Let me see if I can quickly unshare. Apologies. I'll just then have to do that again. Thank you for that. Okay. So sharing the screen. All right, can you see, let me just quickly switch to the website. Can you see the SAMF website now?
Yes, thank you, Doc. Now it's showing.
Fantastic. Okay, so I'm just going to go again, apologies, but essentially what would happen is you, as you enter into the SAMF app, you'll have to then put in your login details. Once you have entered those details in, then I'm going to just see if I can go to the home page to show you. So that will start, and then this is essentially where you'd, this is where the, after you log in, this is where to take you to. So let's just type in again, type in the management of gout. That brings up the results, and we're able to then look at the clinical notes that I was referring to earlier. Succinct notes, but just quick reference text to remind you. And then there's some hyperlinks as well here that you can open up, colchicine, for example, or allopurinol. So let's open up allopurinol, and that will just bring up the allopurinol monograph. Just allow that to open quickly. And I mean, mostly, for example, if you're on the go, then this is going to be on your phone. But if you do, if you are by a computer, or if you're doing a little bit more in-depth work, preparatory work, then the web portal is actually quite nice and quite user-friendly as well. So that will just show you all the various sections that you've seen on the mobile app, and it's very similarly laid out. Okay, so Pete at some point said that he is on Hexazide for hypertension with all the various trade names. Sometimes people can forget. And so let's just type in Hexazide quickly, which should give us hydrochlorothiazide. And then you can see there. So essentially searching by trade name also allows you to get to the generic drug of reference. And at the bottom here, as per the text SAMF, you've got your different preparations as well for the different monographs. So that's really, that's quite useful. And then just the last point is it's really useful as well for looking at the adverse effects, just to remind you of the adverse effects for the various drugs. And actually, if you look at hydrochlorothiazide, just to remind you, one of the adverse effects is hyperuricemia. And so that may be able to influence your subsequent management of this patient to see if you would need to switch to a different agent that doesn't have this adverse effect. Okay, great. Let's move on to the next case quickly. I'm just going to go back to the PowerPoint, and then I'm going to ask if someone can just confirm that I am back on the PowerPoint.
Yes, you are, Doc. Thank you.
Great. Thank you so much. Okay, so case 2 got it's titled A Long List of Drugs. We've got a 70-year-old man who has visited you for a cough as well as increased sputum, for which he was prescribed clarithromycin, which is a macrolide antibiotic. And 3 days later, he returns to the hospital with symptoms of muscle weakness, stiffness, and dark urine. A diagnosis of rhabdomyolysis is made, as well as acute renal failure. And the patient's medical history includes hypercholesterolemia, for which he was taking simvastatin for approximately 2 years, as well as hypertension, for which he was previously treated with irbesartan and hydrochlorothiazide drug combination. He mentions that amlodipine was recently added due to a suboptimally controlled blood pressure. And when you examine him, his blood pressure is 96/38 millimeters of mercury relative to a previously normal blood pressure. He and the rest of his physical examination just shows mild pitting edema. And on ECG, he has features of atrial fibrillation, and his renal function test results reveal an elevated serum creatinine and a decreased eGFR, indicating renal impairment, and a creatine kinase level of 1,500, which is above the reference range. So after you consider various differential diagnoses, you rule out other diagnoses such as septic shock. And after much discussion with a colleague suggests a possible interaction between statins and calcium channel blockers. And so then obviously you're going to run to your handy SAMF. So let's just go back to the website. All right, so let's start quickly by typing in, statins. Okay, get some agents to be avoided or monitored. So obviously very nice because it gives you more than just the drug, gives you different pages as well that you can look at. And just from there, from starting, this is actually got into the lactating section. So let's move on to the amlodipine monograph. Okay, and from there, since we're looking at a possible interaction between the calcium channel blockers and simvastatin, let's go straight onto the drug interactions. We can see there amlodipine, simvastatin concomitant use associated with myopathy and rhabdomyolysis. And so that's really nice, and you're able to get a fairly straightforward answer. And just to point out some of the other things that the SAMF can do is if you do search, for example, clarithromycin, you have to get the spelling right. You know, some of these drugs have very precarious spellings. All right, so we open up clarithromycin and you do a little bit of background reading, and you see essentially that depending on your current knowledge of pharmacology, that clarithromycin can actually inhibit some of the enzymes such as P450, but you would remember that amlodipine is particularly susceptible to that enzyme system. And so just being able to search quickly with the SAMF app, either on mobile or as well as on the browser, you find that it's much more intuitive, and you're able to get your answers much quicker than if you were to have to rifle through multiple pages. And so you're able to get a pretty definite and satisfying answer from there. Okay, let's move on to the last case quickly. This one is titled Post-Operative Complications, and it's a 45-year-old female with hypertension, diabetes, and ischemic heart disease who developed symptoms of insomnia, restlessness, tachycardia, abdominal pain, constipation, and a motor neuropathy on the third day after she had gone for an orthopedic surgery to correct a right foot deformity, during which she had been exposed to thiopentol, which is a generalized anesthetic agent. Erythromycin was also prescribed, as she was noted to have post-surgical ileus, and just of note, she's also on enalapril, hydrochlorothiazide, aspirin, metformin, and atenolol as background therapy. So in this case, you are an internal medicine medical officer, and you're called by the orthopedic team to assess the patient for what they have made a diagnosis of suspected acute porphyria attack. And as part of your management, you are also considering prescribing a short course of amitriptyline to relieve the symptoms of insomnia. So again, let's open up our SAMF. Remember, even if you are on the mobile app, this would all be very similarly done. And so let's start by typing in porphyria, right? Because porphyria, who remembers all the details of porphyria? It's something that you just have to refer to all the time. And there's a very nice, simple, basic section on porphyria with the main types, variegate, acute, intermittent, as well as porphyria cutaneotada, that you can just use to remind you of the important things. The next really important or really nice section is on safety classification of drugs. And it actually has quite an in-depth section on the different drugs that are possible porphyrinogenic agents, and it also has the guidelines for the safety of drugs in porphyria, where it actually classifies almost all the commonly associated drugs with porphyria. And so you could search through them, and you could either go through them individually, or what I'm going to try and do here is, let's see if we are able to actually get a hit. I'm actually going to try and search for thiopentol and see if it comes up. Okay, and there's thiopental sodium. It's labeled as P, which if you look on the previous page shows you the legend, and so that definitely is a porphyrinogenic agent. And so you've essentially been able to nail your diagnosis, right, just right there and then. And so I found that that's very helpful. And then the last consideration that we had was whether or not to give amitriptyline. And really what I want to focus on here is some of the other special prescribing sections, such as the QT intervals, some of the agents that may possibly cause long QT. And there's also a very nice section here. That's one of the considerations that you have to have when you're considering starting a patient on amitriptyline or some of the other drugs that can prolong your QT intervals. And again, there's a nice section on possible QT, torsade, which is one of the complications that you can go through, and obviously very handy and accessible information. And all of the drugs, again, are categorized. And so just in these three examples, we've been able to kind of intuitively work through the SAMF platform, and it's been able to show us that it's actually very, very easy and very intuitive and very informative. So that's come to the end of the practical session. Just this page is essentially just it's showing the QR code. It's easily available on the Google Play Store. You just need to search SAMF on the smartphone, and then you sign up. And this is alternatively the QR code here that if you just use your camera to scan, it should actually take you to the page. And then for group subscriptions, then you could also use this email address, and potentially maybe one of the other panel members could go into that. But otherwise, thank you. And I think that's the end of the interactive session.
Thank you very much, Rephaim. Very grateful for the breadth of the presentation and the ability to show how versatile the app is and the digital platform. I see that we have some questions. I've answered one already. I don't know where it went to after I answered it, but I did. I've answered one already in terms of the chat, but this is the opportunity for the colleagues to ask any questions they'd like to. And so maybe we can start with the Q&A that's there already while people are thinking about what they'd like to ask. And so there's a question in terms of, I'm a regular purchaser of the hard copy. I purchased the previous edition, earlier editions. So will SAMF provide the electronic version to long-term users of the hard copy at a special price?
Thank you, Prof. If I can come in here, it's Diane from SA Medical Association. Your answer did go to answered, by the way, if you click on the Q&A. I would just like to say that, Doc, as a SAMF member, your discount was given on the actual hard copy of the book. Unfortunately, we cannot discount the app price because with Google Play, etc., there's certain technicalities that we need to adhere to. So your discount, because you are a regular purchaser of the hard copy, is actually on the SAMF book. I know there was a question in some of our chats that is the SAMF app replacing the book? I would like to say no, it is an addition to the book. People still have the option of having either the book or utilizing the SAMF app, or both. It is your choice. Thank you.
Thank you very much, Diane, for answering the questions. So the floor belongs to the colleagues. I see there's another question. That's the same question. Are there any other questions that that colleagues may have to Rephaim, myself, Anushka, Diane, around what you've seen, some thoughts around the digital versions?
Sorry, Prof, if I can suggest you just run through all the questions that you've already answered, so we have Perfect. It for when it comes to the YouTube and everything is live. Thank you.
So the one question was around the ADR. There's an ADR form in the book itself, and we encourage adverse drug event monitoring and reporting. And the question was, would the app be linking? And what I've suggested is that in our phase 2, it's a very good question. In our phase 2, we'll be looking at, in fact, the beauty of the app is to link to as many environments that provide better access to medicine information, and that we have a mechanism to safely look after our patients. And this is one of these. Package inserts would be another. And we'll be exploring this option, and it will all be up to the SAPRA if they're willing for us to be able to link to the Med Safety app. It's an excellent question, an excellent way forward to be able to report adverse events very quickly on your fingertips. Technically, Mercedes has commented that it's not difficult to do. It will require collaboration with the SAPRA app. I'm not seeing any questions. I'm just to see if there may be hands. There's no hands.
There are some questions on the actual chat instead of the Q&A.
Thank you for taking me there. Good. Let's just run through them. You can see why Rephaim did the presentation. You can see my ability to be technically on my laptop.
Mark, can I step in here?
Yes,
Anushka?
I've got one question there. Thank you, Anushka.
Yeah, so there's a question about, can one use the same profile on multiple devices simultaneously? And the answer to that is yes. If you buy a subscription, you can simultaneously access your PC and phone and tablet, up to 3 devices at one time with the same profile.
Thank you. Are there any? Were you able to pick up any other questions, Anushka or Rephaim, in the chat?
There was one about the price of the app. So if we'd like to say, if you're going to purchase on the Google Store, it is 800, or the Play Store, it's 809.99. Or alternatively, you can have a monthly subscription of $79.99. Thank you.
Thank you.
That seems to be all, Prof. We will be sending out the link to everybody from that participated. So over to you for the closing.
Thank you for that. So thank you very much, everybody, for joining us. We're very, very grateful. In fact, we are very proud of the offering in the digital space. We've been able to bring this together through the traumatic times of COVID-19 as well, and bring people together to collaborate to bring the offering. So we're grateful for that as well. We're very grateful for Mercedes off at the moment for being able to provide the technical support, and obviously all the colleagues who have provided the clinical insight into the content of the app, and obviously to Sama and then you guys for joining us for this demonstration. And we hope that you take this forward, you show the YouTube, and you advertise on our behalf to people who are interested in drug information, and all SAMF users that have used SAMF since 1988. So thank you very much, everybody. Thank you for the organizers. And some of us have used it for such a long time. I see Rephaim, yep, for such a long time. So thank you very much, everybody, and for the organizers. Be safe out there and take care. Bye-bye, everybody. Have a good evening.
Have a good evening. Bye.
Bye-bye all. Thank you.
Bye-bye.